Welcome back to another episode of the Scale Smart podcast. I'm your host, Jacob. I'm also the CEO and founder of NetScale Growth. Today, I have the pleasure of being joined by Debbie Rogers, the CEO of Reach Digital Health. Debbie, thank you for joining me today.
My pleasure.
So, Debbie, kick us off. Tell me a little bit more about yourself, your experience, and what led to you becoming the CEO of Reach Digital Health.
I actually was started off as an electronic and software engineer, but I was one of only 8 women in a class of 180, and I did not like the bro culture at all. So I ended up then going completely in the opposite direction and doing my master's in digital art. And what I really liked about art was I could say something about the world. Like there was the activist in me was really happy, but I didn't feel like I was doing anything very practical in the world. So I became very disillusioned. And I don't know if it's just because I was disillusioned, but I ended up lecturing and working in advertising and marketing and selling lots of products, selling lots of alcohol and mobile phones and various other things. But was lucky enough to meet a man called Gustav Preikelt, who had just started a non-profit business that was using mobile technology to improve health. And I found the place where I wanted to be. I was able to do something to change the world, but I was able to use both my technical and creative skills, as well as even my advertising and marketing skills. And I became the designer of the services that we rolled out in the organization. And then over time moved through various management roles until I was became CEO about 4 years ago and rebranded the organization to Reach. So yeah, that's a little bit of my story.
Amazing. Now tell us, what do Reach do? What do you guys specialize in?
So we use very, very simple technology. So this is things like SMS and WhatsApp, things people have on their phone every day and use to communicate to their friends and family, to communicate to them to help them improve their health. So either by helping them to care better for themselves or to access the right services at the right time. So an example might be encouraging a mother to go and go to have her antenatal visits at a clinic, or helping her to practice better nutrition so that she has a healthier pregnancy. These are the types of things that we do by sending behavior change messages directly to individuals. And we do this at a national scale, working with governments and essentially being an extension of the healthcare system.
Amazing. And what are some of the challenges you have had, obviously becoming the CEO of the company 4 years ago? What are some of the challenges you've encountered within that 4 years when it comes to growing the business, obviously becoming a CEO, because you started off as you was a managing director before, wasn't you?
Yes, I was. Yeah. So I think what we've seen is we did really amazing projects in South Africa, and we managed to grow them to national scale. Um, and we, have one of the first programs in the world to be able to do that, which is really fantastic. But replication into other countries is a very different set of skills. And so we've been replicating, we've now replicated into Mozambique and Zambia, hoping to replicate into Nigeria this year. But we're definitely finding that each space has its own peculiarities. It's not a case of once you've expanded into one country, you now have the recipe. Each country has its own challenges, its own nuances. And so we're learning as we go, as we expand into each of these countries. And so it's not as fast as I would like it to be, I have to admit. But we're plodding along, and I think having learned a lot of lessons in the two countries we've replicated in so far.
Amazing. And we're going to talk all about AI in this podcast today. So tell me, Debbie, what helped Reach get some real good results with AI when quite a lot of people struggle to get the results?
hmm I think one of the big things is we've got these really large scale programs. We've been running them for a number of years now. For example, Mom Connect in South Africa has been running for 10 years with the National Department of Health, and we've had 5 million mothers on it. So we have really vast amounts of data. And it's pretty high quality data as well, because we spend a lot of time making sure that the data we collect from others is high quality. And so I think that's a really good start. There's the whole talk of garbage in, garbage out. And having a really large data set and having experience in this field for the last 10 years really helped us, I think. Also, we are really, really focused on scale. And I think that means we don't always do the sexiest AI work because it's not necessarily as scalable as some of the more sort of old fashioned AI work. The way we think about it is like, LLMs, for example, are kind of like a Swiss Army knife. You can do anything with them. But when we scale into 1 million people, you don't necessarily need a Swiss Army knife. Sometimes you just need a screwdriver to do the job. And so we're really focused on making sure that whatever we do, even if we experiment in large language models, we are implementing with scalable models. So often that's things like small language models, for example.
Hmm. And what challenges did you face when using AI to manage things like user services, and how do you handle them?
So I think the biggest challenges that we faced have actually been more on the political side, or in people being really nervous about AI in general. I think now, the last couple of years, people have been less worried about it, but we've been doing this since 2018. And a lot of governments, we work with directly with governments, they were just really scared about the idea of not having a deterministic model, not being able to know exactly what's coming out the other end. And so we've had to work really hard on education around that, and also making sure that we spend a lot of time around guardrails and safety, because it's paramount to the governments that we work with. So a lot of it was not so much technical problems as it was more political or executional problems. And I think that's often that's where the rubber hits the road, really. The technical stuff, I mean, my engineers will shout at me for saying this, but the technical stuff is obviously often the easier part of what we do.
Hmm. I spoke to someone just before this on another podcast, and I asked them like, what was some of the biggest like things you get when it comes to incorporating AI into businesses, and they said some businesses just are scared about like the data and what they're doing with their data,
Mm-hmm.
um, because I think AI is no longer a trend. It's AI is here to stay, and
Absolutely.
I think companies who don't adapt to it will they may still grow, but the companies that do use it will just outgrow them, outscale them to the point where they just get left behind, and there's just the competition have just wiped them out. So where do you see
Absolutely.
it? Where do you see it going, and what do you think? What would you say to companies who are maybe on the fence of adopting to AI?
I think it's very much like what you said to me. I mean, we're in healthcare, and often there's this thing of the horror that AI might replace doctors. And I think AI is not going to replace doctors, but doctors who use AI are going to replace those who don't. And so I think it's very similar with businesses, but I use the example of doctors because it's this extreme example that you're going to be, cared for by a robot. And I think that it's really important to recognize, as you say, that these things are here to stay. And then I would say, don't use AI for the sake of using AI. That's also a big problem that I've seen. So if people are now decided, okay, we've got to use AI, otherwise we're dead in the water, great, that's the first step. But don't use AI for the sake of it. First, look at the problems that you have in scaling your business. What are the problems within your business? What are the problems that your users are facing? What are the problems from a business processes perspective? All of these problems have potential for AI to be a solution. Look for the problems first. And then if AI is a solution, then you've hit the right kind of problem for that. Some of the problems you'll uncover in doing this experimentation will be not at all useful for AI, but you would have solved some problems anyway. So you can't go wrong in doing that.
Mm. And how has AI helped you personalize the different health messages you guys are sending out, and what impact do you think this has had?
Well, what we see is we really focus on scale, as I said. So we bring people in at a pretty large scale. And ultimately, what we want to do is have an impact. So what we want to do is we want to change people's behavior. So either we want them to do something like take up breastfeeding, or we want them to go and get their children vaccinated. These are behavior changes that we want. In order to get somebody from coming into the service to actually having a behavioral impact, people need to be highly engaged over that period of time. And so, I mean, I wish sending one message changed people's behavior. If it did, we'd all be super healthy, super fit, we'd be fine. It's a lot harder than that. You have to engage people over a long period of time. And so we've been using AI to personalize messages to improve engagement, which therefore improves the ability for us to have a behavior change at the end. So, for example, just understanding something as simple as somebody's age can help us to make the content more appropriate for them, which means they are more likely to be engaged. And so it's all about really saying, understanding more about the user. So using AI to gather more information about the user, then using that to create a personalized experience for the user, and then keeping people engaged over the long term by adapting dynamically to the trends of engagement on the platform. So it's all about that, like moving from touching the platform for the first time to having behavior change and being engaged over the long term in order to do that.
Hmm. And where do you see it going, like AI, over the next couple of years? I just think there's so many new things coming out. Like ChatGPT
There's
just brought
so
out
many new things.
they just brought out the new image generator thing, and I think a lot of digital marketers are kind of like, oh my god, what's happening? Because it's
Absolutely.
unbelievable. It's
It
unbelievable
is
what it can do.
unbelievable. Yeah, I mean, I'm not very good at future trends prediction, but I do know that things are going to change incredibly quickly. And
Mhm.
I think that's another thing for us to really think about. You know, those people who are hesitant to start with AI, one of the arguments I've heard is we don't know what to start with because we don't know where it's going. Well, I can tell you by the time you started, it will have changed. But that's not the problem you've got to get started, because it's going to continue to change at this rate, and perhaps even at a faster rate. You know, as things like cost of compute go down, we're going to see wider adoption. So we're going to see faster changes. And so things are not going to slow down. They're only going to speed up. And that's another reason why, you know, you need to be getting in on the ground floor and starting to experiment now with using AI in your business.
Mm. And what are you guys doing to make sure you stay ahead of any emerging trends or different things that are coming into the market to make sure you're really staying competitive?
So I think one of the things that we're doing is that we try to run like two or three concurrent experiments every quarter. So we'll come up with a question or something we want to experiment with, a model we might want to try. And we try to do that relatively quickly. So do it within 3 months to from the idea to the test to the results, and then move on to the next one. So it's really about trying to stay nimble and trying to continue to test these ideas. If you have to come up with a giant 1 year project plan, and then by the time you've gotten into your project something has changed, you're not going to be able to keep up with the trends. So really trying to be nimble in our hypothesis testing and in our model testing, and making sure that we don't take too long to do each of those things.
Amazing. And just lastly, Debbie, what are some of the goals? What are some of the things you got guys have got coming in the next 12 months?
So I think a very big thing for us is further scaling our programs in Mozambique and Zambia. And then from an AI perspective, it's really about creating the absolute kind of defined way of collecting data from people in the most effective way possible. Because every time that we ask a question of someone, we have a chance of losing them off the platform, and then we won't have any impact. But we need to know that information in order to be able to engage people over the long term and create a personalized platform. So really, like, hyper optimization of gathering of data from users is a really big focus for us from an AI perspective. And then I think the third thing is that it's very exciting. I believe that WhatsApp is going to be launching the ability to have calls over WhatsApp. And so we're looking a lot more at multimodal engagements and using AI for multimodal engagements across WhatsApp, because I think that's going to change the way we think about our work in terms of literacy and access. For example, in Mozambique, 50% of the people there speak languages that are not written. But if we're able to engage via voice notes and via calls rather than via text messages over WhatsApp, that's going to have a massive impact. So, yeah, those are the three things that I'm just really excited about in the next year.
Amazing. And if people wanted to reach out, Debbie, find out a little bit more about yourself, find out a little bit more about Reach, where's the best place for them to do that?
Well, we've got our website, www.reachdigitalhealth.org, or people are welcome to email me, debbie@reachdigitalhealth.org.
Amazing. Well, Debbie, thank you so much for coming on. It's been great just talking about AI and the future of AI and how you guys have incorporated it. I really appreciate you coming on.
Thanks, Jacob. It's been fun.
Amazing. Thanks, Debbie.